us. I'm really, really appreciative. I'm seeing so many of my mentors, advisors, my seniors here, and it's really a proud moment and a happy moment for me. Um, I am delighted for the session today. We have been brainstorming this idea for last 2, 3 years, as far as I know, but I know Professor Osmani has been brainstorming this idea since 2009 for putting together an online learning management system, a very comprehensive place for teaching short courses, long courses, diploma certificate programs, skills workshops, any sorts of things as possible with this. So with that, let me start the inauguration meeting for APPNA Academy, online courses from APPNA MERIT. My name is Danish Bahati. I will try to switch in Urdu too. मैं थोड़ा थोड़ा बीच में उर्दू में भी बोलूँगा. I hope everybody can follow that. मेरा नाम दानिश भट्टी है. I'm a co-chair for APPNA MERIT. I'm associate professor at University of Nebraska Medical Center, and I'm the director of the Parkinson's disease program and international neurology program at University of Nebraska. And I'm an educator by heart, on my heart, and I do a lot of online teaching, online courses, mini fellowships, and I'm delighted to see that happening today. The total meeting today is divided into two parts. The first 45 minutes is the inauguration event, when we will go through the opening remarks, introduction to the courses, and input from our course advisory committee and our keynote speaker. And we will conclude with a vote of thanks right about 8:45 p.m. Pakistan time. And then we will continue for the course participants to have an introduction with the course faculty for stroke course, the stroke mini fellowship. All the course faculty and participants are requested to continue to stay, while our guests of honors are welcome to stay, but pending their availability and their busy schedule. So let me start with the first half by inviting, um, as per request by Professor Osmani, I will go ahead and invite for a quick comment our president-elect, APPNA 2020, for Dr. Uzman Khalid, for his welcome comments. Dr. Uzman, please go ahead.
Anji, Assalamu alaikum, everybody. And thank you very much, President of APPNA, Dr. Usmani, for allowing me to go first. I'm on STEMI call, and even last night when she called me, I was in the hospital doing a STEMI at 11 p.m. So thank you very much for allowing me to start first and welcome all our illustrious guests from across the globe, especially from Pakistan. This is a very proud moment for APPNA, and it's history in making that APPNA has come to this point in which our vision has always been part and parcel of that has been education. And certainly with APPNA Academy, we are certainly reaching a stage in which we will be able to provide first-class education in an online forum, as well as hopefully, inshallah ta'ala, in the future, in a physical format as well, which we have done in the past, under the, under the auspices of APPNA RISA committee as well as Merit committee. So I want to just thank everybody for joining us. I want to really thank all the panelists and the speakers that are going to participate in a lengthy session that we would be having. I'm certainly involved in the cardiology program, and I know Dr. Mutin, who's the lead for APPNA Cardiology, has been working very hard to try to put everything together for all the speakers and our participants. So I'm very, very thankful to all the participants as well. And we hope that we would be able to play a small part in your education. And ultimately, you will be the learners of today will be the educators of tomorrow. And certainly, this is what we think that the goal of this particular academy will be, that our students today will be the teachers tomorrow and will help us further advance this program. I would also really like to thank Dr. Shahid Rafiq, the current chair of APPNA Merit. and Dr. Danish Bhatti. This could not have been done without the hard work that they have put in. And certainly, I will recognize Dr. Naheed Usmani, who has been a champion of furthering the goal of the merit program in APPNA. As the president-elect of APPNA and taking over from, well, we do things together, but my presidency will start January 1st. This is a program that not only will be continue, but this is a program that we will build and will further advance, and I'll make sure that it stays one of our priorities in APPNA. The team, I'm very proud of our team. The executive committee has supported APPNA Merit. Again, at the end, I would like to thank all the illustrious guests, the President Pakistan Neurology Society. I know some of the leaders in neurology from the US. I see Dr. Adnan Siddiqui and many others that are here today. I really thank them for taking time out on a Sunday morning and in the US and Sunday evening in Pakistan to join us and be part of this inaugural. And I pray that this is only the beginning. Thank you very much, Dr. Bhatti, Dr. Rafiq, and Dr. Usmani. Over to you, Dr. Bhatti.
Thank you so much, Dr. Rizwan. So let me invite and welcome President APPNA, Professor Naheed Usmani, who has a special place today as the inaugural chair of APPNA Merit. The life has come full circle. She is now leading the charge and task of transitioning APPNA Merit to its second stage. Professor Usmani, please go ahead with your welcome remarks.
Ji, Assalamu alaikum. Thank you so much, Shahid and Danish. APPNA Merit had a very humble beginning, just as a task force in 2007, where we appropriately identified that it is not the teachers who are central to the merit concept, but it is the learners in Pakistan. So the initial phase of how APPNA Merit was developed, we went to Pakistan and interviewed all stakeholders like medical students, residents, faculty, program directors, CPSP, PMDC at that point. We interviewed everyone to find out exactly how APPNA could, develop the APPNA Merit program. And with their input. So everybody should feel proud for this moment because it's their input that has led APPNA Merit from strength to strength. In 2009, APPNA Merit started long distance webcasting, lectures, etc. on a regular basis. And 2012, we tried to establish a long-term, a long distance management learning system, but we just did not have the funds or the ability to do it so. But it was a dream that I carried with me throughout the next 13, 15 years, however long it has been, because you really, to make an impact, you have to have a sustainable course, a sustainable, objective that you are delivering to the learners in Pakistan. And I am so very proud and thankful of both Shahid and Danish for implementing this learning management system that I think has immense potential. We can run so many courses. We can, be hand in hand with partners across the world and in Pakistan so that we tailor what we do in US to what is needed in Pakistan. I think that the biggest, capital APPNA has is its membership, highly trained consultants that are members of APPNA. They are the faculty who will be teaching and being role models for learners in Pakistan. And that can only happen if there is live face-to-face interaction between the learners and the teachers. I teach medical students, and believe me, it is the most rewarding part of my job to mentor them and to take them to next level. And that can only happen if you have face-to-face interaction. So I'm so very glad that we are inaugurating the APPNA MERIT Academy. I think it has great potential. It will be the gift to Pakistan from APPNA in the long run. Thank you very much.
Thank you, Professor Usmani. Let me welcome Chair of APPNA Merit, Dr. Shahid Rafiq, to introduce APPNA Academy's concept. Dr. Shahid, please go ahead.
Assalamu alaikum, esteemed guest from Pakistan, Canada, and US across the globe. It's very heartening that such elite leaders and especially Surgeon General Johar, Dr. Nigar Johar could make it, and we're very happy to welcome you all. The concept of APPNA Merit Academy is that we have experimented in APPNA Merit many distance learning as well as on-ground capacity building programs. And there were a very successful program for a decade where we had a lecture and Pakistani medical students and institutions would sit and listen to it. But I always felt that that was, a potpourri, although it was very, it served its purpose for many years, but the impact-wise, I thought it makes more sense to focus on a skill or a knowledge or a topic than having different topics altogether, and people did not know what the target audience, assembling those target audience was difficult. So that's where it came, the idea, although Dr. Naheed Usmani, who's the founder chair, had this vision from the beginning. And as she told you about APPNA Merit, she laid the foundation, she had the vision. But of course, I think in the past 2 years or 3 years, it was Danish who really helped materialize this this vision and build what we are here today. This what you see, this program, this if you want to call it a building, was started by Dr. Naheed Usmani. And Danish really has helped bring about all the programs, all the courses. He himself started a course in movement disorder 4 years back. So we also got the idea from there and built upon his experience and leadership. I'm also very thankful to Dr. Salim Baresh, who is the president of Pakistan Stroke Society, to be here today. We are really honored because this program, the stroke program, belongs to neurology. And with the cooperation of Pakistan Society of Neurology, we feel that it has more support in Pakistan, as well as Pakistan Neurology Society has some components, and it has a separate society for stroke. So I'm also very honored that Pakistan Stroke Society President, Dr. Anjum, is here. And so welcome all. But while we are talking about different courses, I think particularly the stroke course, it started with one, very elite leadership, General Imran Fazal, who is the DG Medicine. He is the one who actually introduced me to Pakistan Medical Corps and Army Medical Services, and took me to Surgeon General at that time in 2017, Dr. Bajwa, General Bajwa, and I asked General Bajwa that what are the top priorities in Army Medical Corps that we can address, and he named stroke one of them. And we have tackled others also, like family practice, ER, and intensive care unit. All of them we have been working with. So it gives me great pleasure that we are fulfilling that promise. And then MOU were signed earlier this year in March, in line of that. So it's all coming together. And then, of course, talking about the stroke, it is really, really great honor that two of the biggest names in stroke, I don't know if all of the attendees here know them, but I would like to mention them. Professor Ashfaq Shoaib from University of Alberta, Edmonton, is really pioneers work and great researcher, professor, teacher, both in Pakistan and the international world knows him. And I'm really thankful that he's here. And the second name is, of course, Uzman Qureshi, who everybody knows, not only in stroke world, but in general neurology. I learned from him. I'm a stroke specialist, and the first course when I was doing the certification in 2008, I attended a course for that exam, and he developed that course. He taught us, and I passed that exam. So I'm always thankful for him, and really appreciate his presence here. Finally, I would say that this is also I would say ladies power, ladies night, ladies day, and I would like to mention that not only General Nigar Johar is leading the Army Medical Corps, and here Dr. Naheed Usmani is leading APPNA, and also Pakistan Stroke Society is president is Dr. Anjum. So more power to ladies. I hope they will continue to see more ladies in the powerful position, heading institution, heading movements. And so with that, Danish, thank you for allowing me to welcome and present the concept. Of course, Dr. Fareed Suri will tell more about the stroke program.
Thank you, Dr. Shahid. Let me invite our course director for stroke mini fellowship, Dr. Fareed Khan Suri, to introduce the program. Dr. Fareed.
Thank you, Danish. I'm very excited to be a course director and with Dr. Shahid Rafiq. This course was originally outlined by Dr. Ismail Khatri and Danish, actually, about, I think, 3 years ago, if I'm right. And then we got the opportunity, I got the opportunity to become a course director and start participating in this with Dr. Shahid Rafiq, and I've been working on it for about 1.5 years now. And we have developed it into a very comprehensive and clinically pertinent, covering probably more extensive education material than we normally cover in an ACGME, actually a stroke fellowship here in US. We sought out any well-established stroke and neurocritical care neurologists in US, and we are very happy that we were able to gather an amazing team of neurologists from all over the globe, including Pakistan, as faculty for this course. We are anticipating, hoping, and expecting that it will keep on getting better and better over years and become a more recognized as the time goes by. I'm definitely looking forward to starting this, be a part of this long-lasting tradition. So I'm very happy that I got this opportunity and excited to move it forward. Thank you, Danish.
Thank you, Dr. Fareed. And we'll hear more from you about stroke in our second session.
Yes.
So please stay tuned if you want to know more about this mini fellowship. We are launching APPNA Academy with 2 courses online starting from tomorrow. And then we'll be adding 8 more courses over the next month into this academy as the beginning. The second course that we're launching is a really, really important and useful course on point of care ultrasound. And to introduce that course, let me invite the course director, Dr. Ruzina Badal Munir. Dr. Ruzina, please go ahead.
Assalamu alaikum, everyone, and thank you for the attending this webinar. I'm Dr. Rosina Badal Munir, and I'm an ultrasound specialist and educator. I work in a hospital in Los Angeles. My passion is to promote the ultrasound in every specialty of medicine. And this is because of this passion that every year, whenever I visit Pakistan on a family visit, I always attend 3 to 4 hands-on training workshops in different teaching hospitals in Pakistan, and so far, and also in UAE. So far, I have proctored in couple of workshops at CMH Peshawar and Rawalpindi, Air Force Hospital in Islamabad, CD Hospital in Islamabad, Lady Reading Hospital, and KMU in Peshawar, and a few private and government hospitals and the medical colleges in United Arab Emirates. I'm very thankful to the APPNA MERIT Academy that they have provided me the chance to promote this passion also, and to present the focus course on the APPNA MERIT. Now, as the Dr. Danish mentioned that focus stands for point of care ultrasound, and you can name it also as an emergency ultrasound, critical care ultrasound, or the bedside ultrasound. Now, the main purpose of this course is that every medical professional, and especially the physicians and the specialists, they should know this course, because it helps them to immediately assess their patients and towards the proper management, and also to monitor the progress of their patients. So this focus course on the APPNA Academy, it consists of 17 modules, and it is presented in a very simple and easy way. I tried my best that it should be in such a way that everybody can follow it very easily. All the techniques and tips of how to scan and all those basic exams are presented in a very nicely manner. So I'm sure that you will learn a lot if you guys participate in this course. And at the end, I would just say that thank you to all of you, and join this course and keep practicing. Thank you.
Thank you so much. And I would now move on to our course advisory committee for our flagship course, which is the mini fellowship in stroke. And it's really a comprehensive 1-year program with 9 months of education or didactics, really designed in comparison or similar to an actual live fellowship in stroke that is done. And as Dr. Suri was mentioning, the education provided is probably even more comprehensive than what would you expect from a stroke fellowship, a 1-year stroke clinical fellowship in the United States. So it would not have been possible without the leaders in education and leaders in the field who have made this possible as our collaborators, as our advisors. So I would love to hear their comment about the course itself, but also the concepts of collaborating, long distance learning, and educating in Pakistan. With that, I will start with our most esteemed advisor, Professor Ashfaq Shoaib. Professor Ashfaq Shoaib is a professor of neurology and medicine at University of Alberta in the stroke program and director of the stroke program. He has over 400 publications and have done extensive work. But the most impressive work for me is his role in establishing stroke as a field in multiple countries in the region. Many trainees or experts in stroke in Pakistan was trained by him. He continues to take fellows into his program in Canada for training. And he has gone personally to establish stroke programs in other countries by taking leave of absence from his work at University of Alberta, which is a really, really proud thing for me. So with that, let me invite Professor Ashfaq Shoaib for his comments.
Thank you, Danish. Assalamu alaikum. It's indeed a proud moment for all of us. I sit back and listen to what has been accomplished and what you've all done. Truly amazing. So yes, I happen to believe that stroke patients should be treated by stroke specialists. It doesn't take much, but it does take enough time and effort, because they're not the same as treating any other individual who's, I'm a doctor. It's almost like saying, adults training pediatric patients. They're not little people, they're actually different. Similarly, in neurology, stroke is actually a specialty which is very separate from general neurology. And unfortunately, capacity building has been a challenge, not only in North America and across the globe, but in particular in countries like Pakistan and India and sub-Saharan Africa, because it's the second leading cause of death. Amazing. It's actually amazing how big the problem is and how little attention has been paid to it. You've said correctly, we've had more than 150 neurologists who've gone through our program over the last 30 years. We currently have 8 stroke fellows, 4 of them are from Pakistan. Absolutely amazing, very bright individuals, and many of them actually gone back to Pakistan also. So capacity building is what it's about. Leadership is important. The course content is very important. And as you've said correctly, it's a time, it's a tradition. So when you look back 10 years down the road and see all your trainees who can hopefully stay academic and provide excellence of care, I mean, that's where you want to be, right? So congratulations to all of you. As I've said privately to Shahid earlier, we are available for any service that you'd like us to do. Some of you who are in the stroke world know that we have 6 stroke neurologists in Edmonton, all trained locally from Pakistan. And in proper traditions of Pakistan, right? I'll ask them and they'll do it. That's how it works. So congratulations to all of you.
Thank you so much, Professor Ashfaq. So it gives me great pleasure to invite one of our colleague and advisor, President of Pakistan Society of Neurology, Professor Salim Badech. I want to say that Pakistan Society of Neurology has been a strong pillar of support and collaboration for all of us. I personally started my journey by actually working under PSN with this online education 5 years ago, started many short courses, skills workshop, and they kept on inviting me and they wanted all the time I could give them. And I'm really, really thankful to them for guiding us and advising us and being there for us as a collaborator. Professor Salim Badech, please go ahead.
Thank you, Dr. Danish. Respected guest of honor, Lieutenant General Nigar Johar Khan, APPNA committee members, the advisory committee, and APPNA team. Assalamu alaikum. So let me congratulate APPNA President Naheed Usmani and the whole APPNA team for launching APPNA Academy, an online comprehensive learning management system to develop short and long course, certificate program, and workshops. I'm thankful to the whole APPNA team for selecting 20 neurologists for the set program. As we know, the stroke is a global problem as it continues to be a widespread disease worldwide. Currently, it's the single largest cause of disability and the second largest cause of death. If you see the stroke in Pakistan perspective, situation is even much worse. Due to lower rate of literacy, the risk factor for stroke are poorly controlled. Even they unaware about their hypertension and diabetes, due to which our mortalities are much higher. A lot of work is required in this regard. Secondly, much important is low number of stroke specialists in the country. If you see the ratio of general neurologists in Pakistan, it is about 1 neurologist for about 0.8 to 1 million people. So you can imagine how much stroke specialists we have. So thanks to APPNA for initiating this mini fellowship program, which is a much need of time. My congratulations to the neurologist from across the country who has been selected for this mini fellowship program. Once again, I'm thankful to President Dr. Naeem Usmani, Dr. Rizwan Khalid, and the course coordinator, Dr. Danish Bhatti, Director Dr. Farid Suri, and the Shahid Rafiq, Dr. Zina, and the whole advisory committee for their enthusiasm and their untiring effort made this program possible. Thank you all.
Thank you so much, Professor Saab. My next guest that I would like to invite for comment is a really visionary and forward-thinking person, Professor Imran Fazal, Director General Medicine, in Army Medical Corps. I really look forward to interactions with Professor Imran Fazal because it takes key people like him who are willing to change and try something new, which is really hard. Changing status quo, changing what's working, and experimenting with something that may or may not work. And it takes really strong courage to be able to be that visionary and forward thinking. So, Professor Imran Fazal, please go ahead with your comments. Sir, you're muted.
Danish, thank you very much. I'm really honored by APPNA MERIT team, and I'm really thankful to Professor Naheed Usmani, Professor Khalid, and Professor Shahid Rafiq in letting me be part of your team. So one thing is very clear, that in Pakistan, we are definitely interested in capacity building of our human resource in medicine. And in Pakistan Army, we are deeply involved and we are very keen to do the capacity building. And we have tried our level and with various collaborations. And especially we are very, very thankful for your team, the way you have devised these courses for the medical professionals. My residents and my faculty, they are very happy and they are very enthusiastic to learn from such avenues. And although distant learning program it is there, in the field of medicine, but now I think year 2020, especially after this COVID environment, this is becoming very popular. And although you have planned it already, but now you are launching it just at the tail end of COVID environment. So I think that this is going to go a long way in serving the humanity, in making things simpler for the people, and in and putting the treating physicians and treating neurologists voice. As regards Pakistan is concerned and Pakistan Army is concerned, we are all committed for our learning. It is not only a learning of neurology, stroke specialists, it is learning for all of us. It is a learning for the entire medical community. And I think APPNA MERIT has taken a leap forward in making these efforts, and we very well recognize it, and we are proud of you. Thank you very much, Professor Naheed Usmani, Professor Danesh, Dr. Khalid, as well as Dr. Shahid Rafiq. Thank you all. And Dr. Suri and Dr. Adnan, we are grateful and we are happy to have you on board. Thank you.
Thank you so much, Professor Imran. And let me welcome our next speaker, Professor Waseem Ali. He has been a personal mentor and advisor to me. And as Shahid said, that we spent last 3 years, 4 years planning online education and distance learning. And one of the key person who helped me shape and build these programs was Professor Waseem Ali. It would not have been possible without his advice and kind support. Professor Waseem, please go ahead.
Is he still here?
I think he's just joined again. Professor Waseem Ali, please go ahead with your comments and welcome.
Danish, thank you very much. I hope you can listen to me.
Yes, we can.
First of all, thank you. And I need to thank each one of you individually, starting with the APPNA President, Dr. Naheed Usmani, and then of course APPNA MERIT Chair, Professor Shahid Rafiq, and Danish, and all the faculty, including Adnan and Suri. This is a vision that actually started with our DG Medicine, and Shahid Rafiq and Danish, they have put in a lot of effort and a lot of time into developing the syllabus and doing all this. So this is probably going to be a great force multiplier for educating the local neurologist and stroke specialist. And as Dr. Shoaib mentioned, this is one of the commonest disabling disease in Pakistan. And I hope that this would act as a sadqa-e-jariyah. And in the future, these people would be able to help humanity. The coursework and the curriculum development has been excellent. And it is because of Danish, I think, that the online teaching module has come to fruition. And I hope it is going to have a very positive impact in training the local neurologist as well. So I would again thank all of you, and thank you very much for planning and executing this thing. And I would like to thank the new president-elect as well for continuing this thing in the future as well. Thank you very much.
Thank you, Professor Waseem. And next, let me invite a really superstar in stroke world, as someone who everyone is proud of, for being a part of Pakistan, Professor Adnan Qureshi. Professor Qureshi has over 700 publications, and I think there are months when we count one publication a day coming out under Professor Qureshi's name, to our astonishment. He has 10 books, around 3,000 presentations nationally, internationally. He has been awarded multi-million dollars grants in stroke research by NIH. He has set up Zenith Qureshi Stroke Institute, which was my first stop in America when I came to this country. And my first experience was my 3 months research observership in Zenith Qureshi Stroke Institute, which made me where I am today. I'm thankful for that. And he has been helping establish stroke centers in China, in Guinea, in West Africa, Turkey, all over the world. So it's such a pleasure and honor to have you, Professor Adnan Qureshi. Please go ahead with your comments.
Well, thank you very much for having me. My introduction to this effort actually came in a very strange way. I was actually in a hiking trail, and then Shahid called me. And I picked up the phone and I realized that this was something very important. So I said, let me get out of this forest and let's talk. And I think that this effort is amazing because, as all of us know, that there has been a lot of expertise that comes from Pakistan, within Pakistan, outside Pakistan. And yet we did not have a platform where we can all come together and, really create an educational, educational platform for everybody else. As experts in stroke in Pakistan and outside Pakistan, we all have a responsibility to the next generation. And I think that this platform really is the first step towards fulfilling our responsibilities. And on a personal note, I'm really thankful to be part of this platform. Many of you may not know, and Professor Johar, Professor Fazal, Professor Alamgir, they were all my seniors in medical school, and they were my mentors 30 years ago. And today, sharing the same platform with them is a great honor. So I'm very excited. I looked at the course and the curriculum itself. I think this is going to be a very elaborate course. I think it's going to be very informative. In fact, I'm going to be listening to these lectures myself so I can learn something. So thank you very much.
Thank you so much. And let me invite the president of Pakistan Stroke Society, who will be one of our main collaborators for implementation of this course in Pakistan, Dr. Anjum Farooq. Dr. Anjum, please go ahead.
Assalamu alaikum. Thank you so much, all participants. On behalf of Pakistan Stroke Society, I must congratulate the whole team of APPNA for organizing such a wonderful, productive course. And I'm sure that this course will definitely improve the healthcare services in Pakistan in field of stroke. Pakistan Stroke Society is very thankful to the whole team of APPNA MERIT for such a sincere contribution. And this contribution is from those people who are far away from the homeland, but still they are very concerned about improving the healthcare services in Pakistan. So thank you so much. Your efforts, contributions are well appreciated by the Pakistan Stroke Society. And my all best wishes are with the candidates. And after being trained in neurovascular field, I hope that these doctors will be able to manage their patient in a much better way. So thank you so much.
Thank you so much. And with that, we are really at a point where we are looking forward to hearing from our guest of honor, Lieutenant General Negar Johar. As Shai said, it gives me great pleasure to see a woman leader in the place, and that will make us all much better for it. And we were excited to have Professor Naheed Usmani as our president, and now Lieutenant General Negar Johar as the head of Army Medical Corps. And we have a very, very strong collaboration with Army Medical Corps, and we're very thankful for all the opportunities we get in terms of providing back to our country through them. So Lieutenant General Negar Johar, please go ahead with your words.
Thank you very much. Assalamu alaikum to all. And my gratitude to APPNA and the APPNA MERIT. So I have a lot of thank you to do. And starting with Dr. Naheed, I would say that I am thankful to her that she had this dream And because of the dream that we are all here together. And then as the founder chair, she thought that, and she focused rightly, that the learners were needed to be focused, and it is our time to give back to the learners. And of course, they would be the teachers of tomorrow, and they are our future, and we have to focus on them. And then my special gratitude to Dr. Danish, you, so that you implemented and you made it all possible. And of course, to Dr. Shahid Rafiq, who for all his amazing and wonderful efforts for all this. And then to all the participants for being here and for making it all possible. And of course, my thank you to Professor Imran Fazal, who actually, as you said, broke the status quo and made the change possible. And I'm happy that we have Professor Waseem Ali over here as our advisor in neurology. And he's actually going ahead with so many things and interventions for which we had Dr. Suri and Dr. Adnan over here. And it was so good to have them here. And they really worked with us. And we had a good beginning of the neuro interventions. And then my special thank you to the whole of the APPNA MERIT team for their collaboration and being here in March 2019, and for all their efforts, like Shahid Rafiq said, that he went to the chief and everybody else, and then that made it possible. And I was here as a commandant MH, and it was in MH that we had an MOU signed. And as he said, it started for neurology and ER and critical care and family medicine. But I hope that these collaborations will go ahead and we'll collaborate in other fields also, because I feel now is the time of online learnings. And of course, we have to enhance our capacity and our learnings in different fields. And this is the way to do it. And especially in COVID-19, now we know that online learnings, definitely they do improve our teachings and skills and our knowledge, and which is the base. And this 9-month course of neurology would definitely add to all the knowledge and the skills. And especially when the learning is by such big names and big teachers. And I know, although as Adnan said that he was happy that we were her his seniors, but now I feel that there's a time when the students, they grow so big that they become bigger than their seniors. So we are happy to have them on board, and I know that our people would learn. And we have 6 trainees in this course, and as we are heading for the other courses, as Dr. Danish said, that we are going to have 8 more. But I feel these collaborations and these courses should continue, and they should grow in number and enhance, so that we have more of them. So thank you all, and thank you, APPNA.
Thank you so much, madam, for your supervision, your kindness, and your support. With that, let me invite Professor Naheed Usmani for vote of thanks to all our participants and guests of honor and advisory members to officially conclude the inauguration part. And then we will continue with the stroke course focus right after. So please, faculty and students, stay afterwards. Professor Naheed Usmani, please go ahead. You're muted, Naheed.
Sorry, it always takes a minute to find out where the unmute button is. Thank you so much, everyone. Thank you for your kind words, Lieutenant General Nigar Johar. You have been a wonderful partner for all APPNA activities and all our worthy guests. In particular, we are very thankful to Dr. Danish Bhatti for his energy, focus, vision, and Dr. Shahid Rafiq, who is the ideal partner for Dr. Danish Bhatti. Both of them have managed to do in APPNA MERIT, taken it to the next phase. Yes, I totally agree with you, General Johar, that in COVID, all learning has to depend on a virtual environment. And this makes APPNA very plastic, very, ready to deliver and continue its mission of improving medical education in Pakistan. So I thank all the faculty, all the panelists. This has been a wonderful morning session. Again, thank you for joining. Thank you for supporting this program. And inshallah, we'll take it forth and it will grow. There is no stopping APPNA MERIT in future. Thank you.
Thank you so much, Professor Usmani, and all the esteemed guests, and especially our guest of honor, Lieutenant General Nigar Johar. This officially concludes the first half of the meeting, which was the inaugural session. We will continue with the overview of stroke course, which will be moderated by the course director, Dr. Farid Suri. All the participants and faculty, please stay in the meeting, and everybody else is welcome to stay per their availability. Otherwise, we'll take a minute for people who have to leave for their other engagements to let them go. Thank you so much. Thank you, everyone.
Thank you very much.
Thank you so much.
Dr. Farid, if you will tell me who the faculty are, let me promote them or find a way to get them into the panel.
I will share with you the list on the, if you look into the course.
Okay, I saw it in the stroke course.
Yes, I just posted the list that we need to introduce.
Let me get them all into the panel. Dr. Faith, please go ahead. You are the MC of this half, and I will try to stay here as much as I can for support, and I'll keep working on the back end. Please go ahead.
Okay. Thank you, Danish. Assalamu alaikum, everybody, especially the faculty advisory committee who are still on, and the attendees, most importantly, attendees. I don't know if Waleed is there. We may have to move them also in the panelist if they later on will have question and also introduce themselves. But at this point, I would like to once again thank you, the advisory committee, especially obviously the course development team. But I would like to mention, I think I forgot in my earlier time when I had that, like Farid actually mentioned, that Dr. Ismail Khatri was the founder, director of this program. This program, because it started 3 years ago, changed shapes, and also the starting time and availability of different faculties. So the faculty which of course was available, they were available 2018, they were not available in 2019. And the one who were available, some of them in 2019 are not available this year. So, so sorry, there's this warning, Amber Alert here. So basically, but it started 3 years ago, and Dr. Ismail Khatri was the main force behind development of this course, and because of, like I said, availability, and also Dr. Farid Suri getting more involved and taking more part, and revising and looking at it again. And so we really thank Dr. Ismail Khatri, who's still with us, and hopefully can direct the next course with Dr. Farid Suri, or without. These faculties and directors may change, but the goal is that Pakistani neurologists, in particular, in this case, in stroke case, should learn the latest from the stroke specialists across the globe. Like Dr. Ismail Khatri is in the Middle East and had a large stroke program, and we can learn from his perspective. And then we have a faculty from England, UK, Dr. Asim, who obviously bring that perspective. Then Canadian, Dr. Shoaib's team is in it, Ali Nomani, and of course, Dr. Qureshi's team. And Dr. Suri himself has a big team in his program. So I forgot to mention Dr. Ismail Khatri. And then the second name that I forgot is Dr. Waseem Ali. He being the main advisor and lead of neurology in Army Medical Corps and in MH. I think that was the first neurologist that really invited me and showed me his unit in MH, the neurology unit, and really welcomed me at that time, because stroke obviously is a personal thing for me. I wanted from the beginning, since I took over as a chair in 2017, to do something in stroke. So today is the day that that dream has been fulfilled. So I'm really grateful to guidance of Professor Ashfaq Shoaib, Adnan Qureshi, and each and every faculty. If I did not mention any name, the faculty, all the faculty of stroke are really close personal friends and very esteemed colleague. And I'm really grateful that they came together, and they will be the module directors and module supervising faculty during their module that they have taken over. So thank you, Farid. Please go ahead and give us an overview or detail as much as you can of the program.
Thank you, Dr. Shahid Rafiq. I think for the attendees, for the participants of this course, it would be nice if they can hear and see the faculty themselves. So I would just give like a few seconds or a little time for each faculty to introduce themselves, keeping in time the crunch of time. I would, as you mentioned already about Dr. Khatri was the main starting force behind it. I will just introduce one line about Dr. Khatri. He was actually my senior with Dr. Qureshi as a fellow, in a way, because when I was joining Dr. Qureshi's fellowship as a stroke fellow, Dr. Khatri was leaving. So that's my first interaction, and probably I think my last interaction with me on face-to-face. And when I joined the program, all I heard was good words about how dedicated and how hardworking and how meticulous he was and how knowledgeable he was. So all good words about Dr. Khatri. Can you go ahead and introduce yourself, Dr. Khatri?
Bismillahirrahmanirrahim. Assalamu alaikum. I think people are living in something that is not real. Too many things have been talked about me which may not be real. And it's not me, it's Danish who actually pushed me to write this proposal. And I have been thinking about it a long time, and I've been planning to do things like that, but never materialized. So hats off to you, Farid, and Danish, and Dr. Shahid Rafiq, and the whole APPNA MERIT team, that things that I've been dreaming of and trying to make it happen when I was in Islamabad. And after that, never could able to do it. It's all possible because of your efforts, and congratulations to all of you and to APPNA MERIT for making it possible. Thank you very much for letting me be part of this. I'm nobody to be praised like that, what you have been doing. Thank you all. And I must say that my humble training started at Dow Medical College, so I'm a Karachiite. Then I did my residency in Oklahoma City. Then I did my stroke fellowship with Dr. Qureshi. I also did neurophysiology and neuromuscular training, but mostly I'm practicing stroke and trying to teach. My students and residents have always thought of me as a tough teacher and a tough examiner. I don't know how I can keep this reputation online. I don't have a stick that goes from Saudi Arabia to Pakistan to keep the people online, but that's too much of time I've already taken. Thank you all. And I think this is all your effort. Thank you for acknowledging me, but my effort is not as much for rest of the faculty and the students. It's not me, it's Fareed, Dr. Danish, and Dr. Shahid Rafiq. I will inshallah be happy to participate as much I can. Thank you all.
Thank you, Dr. Khatri. I would go in the order that I have. It's kind of like a faculty order that I have in the list, and I've already shared. It's Dr. Taimur Khan. Can you introduce yourself?
Assalamu alaikum, everyone. I'm Dr. Taimur Khan, a graduate of Khyber Medical College, and came to US in 2009. Happened to be part of one of the exchange programs in New York in Columbia University. Then joined an EEG fellowship in Cleveland, and started my residency in Morgantown, West Virginia University, where I stayed as a faculty for 3 years before joining a stroke fellowship last year at National Institutes of Health in Maryland. And the all team, the advisory committee, the APPNA MERIT, they have all been my inspiration, my mentors from whom I've learned. And I was lucky enough to attend the PSN workshops and in-person conferences in the last three to 4 years. But I happened to meet most of our colleagues over there, and that consolidated and kind of gave me a little bit of inside scoop about how things are done over there. And I'm really excited and very thankful to the whole team under the leadership of Dr. Suri, Dr. Danish, and Dr. Shahid they involved me in this course. And I'm looking forward to contribute my portion as well as learn from all of you during the course duration. Thank you.
Thank you, Dr. Taimur. And can I ask Saqib, can you introduce yourself?
Assalamu alaikum ji. I'm not sure. My video is off, but that's fine. This is Saqib. I'm one of the practicing neurocritical care person here in Virginia. I am part of Dr. Suri and Dr. Qureshi's team. I was very honored and fortunate that I joined the group back in 2010 and then been with the group since then. And I had ample opportunity to learn from both of the Dr. Suri and Dr. Qureshi throughout my career. I was started from University of Minnesota, stayed over there for 2 years, and then moved on for my residency to Michigan State University, where I completed my stroke fellowship. And then I completed my neurocritical care fellowship at University of Pennsylvania. Currently, I'm practicing both neurocritical care and stroke at a comprehensive stroke center here in Washington, D.C. And I will be, taking part in the module involving subarachnoid hemorrhage and ICH and neurocritical care part. So I'm honored and humbled that, I got this opportunity, and hoping my best that, whatever I learned through my years, I can share during the course.
Thank you, Saqib. Ahmed, can you introduce yourself? Ahmed Qureshi.
Yes, assalamu alaikum. I'm Ahmed Qureshi. I'm currently working as a subspecialty consultant in physical medicine and rehabilitation, and medical director of the stroke rehab program at King Fahd Medical City. I did my subspecialty training from Wake Forest Baptist Medical Center in neurorehabilitation and interventional rehabilitation. I have a special interest in spasticity. We have about 24 residents at our center in physical medicine and rehab, but we do come across fellows from acute neurology. fellowship program who come and rotate with us. So in this fellowship, I look forward to promote the idea that in stroke care, neurology, and rehab are the two faces of the same coin. And I see a great deal of opportunity to promote the philosophy of holistic care in stroke management and to help the communities understand and develop that stroke care is beyond the disease component and the vascular component of it. So rehab is, is actually the core component of stroke care with or without reperfusion. And if you see the bulk of patients who undergo reperfusion therapies in Pakistan, it is pretty negligible. So the main burden of care in stroke management in Pakistan is actually the functional component and the quality of life aspects of care as well. So I'm very impressed by collaborative efforts between Pakistan Society of Neurology and the neurology fraternity in APPNA and in North America. One of my inspirations is, Dr. Danish, who had been a very driving force in this collaborative efforts. And I've observed when I have been, attending the previous Pakistan Society of Neurology events in Pakistan, the local fraternity is very passionate, and I'm very glad that I'm being a part of it. And thank you very much.
Thank you, Abbas. Very, very nice. Sorry, Ahmed, Abbas, Dr. Abbas Kharal. Can you introduce yourself?
Assalamu alaikum. My name is Abbas. So I graduated medical school from Islamic International in Pakistan, and I was fortunate to move back to the US, where I did a degree in public health at the Johns Hopkins School of Public Health. I did my internal medicine at Johns Hopkins, and then I moved to Harvard for my neurology residency and fellowships in stroke and neuroimmunology, driven by my special interest in cerebrovascular inflammatory disorders. I joined faculty at the Cleveland Clinic last year in Ohio, currently serve as assistant professor at the Lerner College of Medicine, also the associate program director for the stroke fellowship at the Cleveland Clinic. Mashallah, it's an honor to be here with all of you, many of you who, when I came to this country, seeking residency, Adnan Bhai, Shwak Shoaib Saab, many of you were ideals and role models for us. So it's an honor to be here on this platform with all of you. Inshallah, I hope to, inshallah, be a part of this course, and I'll be doing the uncommon causes of stroke module, which will include a lot of inflammatory and cerebral arteriopathies as a cause of stroke, inshallah. Thank you.
Thank you, Abbas. Next is, we'll move on to Adnan Aslam. Dr. Adnan Aslam, are you here? Okay, I don't see it. Maria Junedi.
Yes, assalamu alaikum.
Yes, assalamu alaikum.
Can you hear me?
Yes, we can hear you. Fine, yes.
Okay. So my name is Maria Khan, and I'm a graduate of the Khan University in Karachi. I did most of my postgraduate training as well as my stroke fellowship there at AKU, after which I went on to do a cerebrovascular translational research fellowship, as part of which I did a master's in biostatistics and epidemiology. I've been living in Dubai for the past 6 to 7 years, and here I was lucky enough to be part of the stroke network in the MENA region. I've been involved in research and training in the region, and I'm one of the founding members of the MENA Stroke Organization. It's a great pleasure. I'm really thankful to Dr. Khatri and Dr. Suri for giving me this opportunity, because I do believe that the only real way to sort of give back is to pay forward. And I hope I can contribute meaningfully to this. I'd just like to comment in the end that I was so happy to see that there are at least 3 women in that selected group of individuals that have been taken. And I just want to give a shout out to them. You know, it's very much a woman's field as well. So it's good to see you there. And thank you. Looking forward to the course.
Thank you, Maria. Dr. Abdul Malik. You're on mute, Dr. Abdul Malik. Can you unmute yourself? Is it okay, Dr.
Dr.
Abdul
Malik,
Malik? I
you're
can come back.
muted.
Is it okay? We can come back to you in. I will, Dr. Abdul Malik. When you have the sound, we can come back to you in a second. We can move on for the sake of time. Dr. Husnan Hashim.
I don't think he was able to join.
Okay. Dr. Asim Ali from UK. He didn't join. Yes.
No.
Adil Malik. Adil, are you here?
I don't think he.
Oh, yes.
Assalamu
Okay.
alaikum, Dr. Suri. Thank you so much. So my name is Malik Adil. I came to US in 2011, worked with Dr. Adnan Qureshi for 3 years. And wherever I am, I'm just because of him. I did my neurology residency from Oshner Clinic Foundation. I did my vascular neurology fellowship from NIH. I'm an assistant professor of neurology at Johns Hopkins University School of Medicine and also a medical director of a stroke program at one of the Hopkins facility, which is suburban. And I'm very excited to be a part of this group. Thank you so much.
Thank you, Adil. Dr. Abdul Malik, I don't know if you have a sound yet. Okay. We can move on to the next part, which is basically just the introduction of this course. I was trying to see if I can share my screen with them. Let me see if there is a share the screen and desktop. It just asked me for the system preferences and all those kinds. Is it possible, Danish, if you can share this, let me see.
I'm not sure. I tried unmuting Dr. Malik, but I was not, no issues from here. So I'm going to have him try to rejoin.
Okay. Can you see my screen now? Or?
Not yet.
Okay, 1 second. I'm going to pull it up. Now you can see it. You can see it now?
Yes.
Okay. So let me see if I can make it bigger. Okay, so this is basically our outline of the course, and I will actually go into a brief. This is a document that we will be sharing with you in a day or two. And this document basically goes over the full details of the course. It was originally started by Dr. Khatri and Dr. Danish, and then me and Dr. Shahid and Dr. Danish, we just built on that. So this will have all the modules, the calendar, when are we starting, and there are the course will be in different modules. We have 12 modules, and for each module, we have one or more faculty that will be the primary responsibility of that module. So the way the course will be run is that there will be for each module, there will maybe one or more on presentations that will be uploaded by the primary faculty. And the trainees will go over those presentations. There will be some tasks associated with that, for example, some literature view, some report, and there will be pre-test and post-test for each of those modules. There will be a full pre-test and post-test for the whole course also. And during the module, there will be a discussion, clinical scenarios discussion on an online forum like WhatsApp, and during those discussions, the trainees will be encouraged to bring up cases, discuss questions about any of those presentations, about the task, and the faculty will help them participate. The trainees will be encouraged to discuss among themselves and to clear their concepts and to clear the management of the patients. Going over the modules briefly, the first module is the understanding stroke literature and stroke epidemiology. So we will start from the very basics. Before we dig into the stroke, we will be going into how we read the clinical trials and what the concepts behind different studies. Then we will move on to the etiology and pathophysiology of the stroke, basically covering the risk factors and the main reasons the people have strokes. Moving on to different stroke mimics, typical variants, and different clinical presentations for large vessel strokes, lacunar strokes, TIS. This will be module 3. Then we will dig into the cerebrovascular anatomy and imaging in stroke. And it will also include how the workup is planned and done, and some concepts about collaterals and the pathophysiology, basically. Then we move on to ischemic stroke, basically acute and long-term management. This will include more acute care management, like decisions about alteplase, thrombectomies, other acute management in acute stroke patients, and then other in-hospital care, and the workup, more completed plans about how do we work it up. Intracerebral hemorrhage, its emergent evaluation, and also the etiologies and workup and planning and further prevention. Subarachnoid hemorrhage, this will cover most of the neurocritical care also related to cerebrovascular diseases. So we will go into the initial evaluation of the patients, prognostic indicators, and then going into the etiologies and in detail, and then going into the basically critical care management will all be covered over here. Stroke rehabilitation and spasticity, these two modules, I think they're switched. I didn't change them over here. Stroke rehabilitation will be module 9 and spasticity will be module 8. And very extensive coverage on these topics, and basically covering all aspects of stroke rehabilitation, management of spasticity. Then uncommon stroke etiologies, covering other things that have not been covered. This will be other rare etiologies. As we know, the list for stroke etiologies keep on growing as the things become more rare and rare. So we're trying to cover everything, almost everything that we can be covered in this session, in this module. Systems of care, Dr. Shahid Rafiq will be covering it with Dr. Waseem Ali in the systems of care and medical ethics. I think it is a very important topic, discussing about the medical ethics and establishing systems, how to set up a stroke system so that the participants can now move on and plan and manage a full stroke system. And then in the end, we will have discuss about how to conduct your own research, basically training you into like doing some basic analysis, gathering data, planning studies, doing some epidemiological studies. So this is overall the course outline, and I will ask Dr. Shahid Rafiq to add to that if anything.
Yeah, thank you, Farid. This was very helpful. I think my advice to the attendees is that because it is our first pilot course, we also would like to learn from the attendees, whatever they need, whatever they want us to do, whatever they their needs are. I mean, obviously stroke as a disease is the same everywhere, but the local context, local ground realities can be different. And so my hope is that the faculty and the attendees will really form a great family and a group where they really learn from each other. We want to learn from our Pakistani colleagues. All attendees are already neurologists, so they are our colleagues. It's just that we are trying to maybe talk about the latest in stroke world, but otherwise we are all colleagues. We will work together as a team to learn from each other, as well as learn more what needs to be added to the course. So that's my point, that this being the first course, we would like to make the second course better than the first, and third course better than the previous two courses. So I think we were not able to, because of the constraint of time, let every attendee introduce. But as you are already introduced with the faculty, some of the faculties could not come, but I saw Dr. Ali Nomani is there. If we will give him a chance to introduce himself also. But but I would say that as you start the modules, you will meet your faculty of that module more and learn more about him or her, and also about the topics. And I actually would like that if the faculty, the whole, all faculties, if they have time, whenever they have time, can join any module that is ongoing. So for example, if the first module is assigned to Dr. Fareed, but I would say that any faculty, including myself, I plan to attend most of, if not all of the modules, but any faculty or all faculty, if they can join that module, we will learn from them also. Maybe they will bring a different angle. Maybe they'll bring something that needs to be added to that module as it lays down what needs to be taught. And of course, we're looking forward towards our advisory faculty, Dr. Ashfaq Shoaib and Dr. Adnan Qureshi and Dr. Waseem Alamgir, and also Dr. Anjum, President, Stroke Society, and our Pakistani colleagues and faculty. So I think it's a team effort. Fareed is steering the ship, but I think we all need to empower each other. We all need to come together. And that's my message. So hopefully, inshallah, this will be a great effort. We all will learn from. If Adnan Qureshi is saying that he will learn, I'm sure all of us are. It's a great effort altogether. So Ali, if you can unmute and introduce yourself.
Sorry,
Ali,
yeah, I forgot Ali. I missed Ali in the list.
Okay,
Yes.
that's okay.
No, that's okay. That's okay.
Yeah.
Okay, can you hear me?
Yes.
Yes, we can.
Sorry, my webcam, I don't know why it's not working. Assalamu alaikum, everyone. Thank you, Dr. Danish, Dr. Shahid, Dr. Suri, Dr. Ashfaq Shoaib for this APPNA MERIT forum and the stroke mini fellowship we are going to start. So I'm Dr. Ali Namani. I graduated from King Edward Medical University. Did my residency there in Pakistan, did specialization, and then moved for stroke fellowship under mentorship of Dr. Ashfaq Shoaib. So I'm in my third year of fellowship, and I've been doing simultaneously my PhD in neurosciences. And my work is sort of more so related to neuroimaging, including especially perfusion imaging and translational part of it, including genomics. So I'll be covering the stroke imaging and the vascular anatomy part of the mini fellowship program. I'm grateful to everyone, including faculty and participants, for this great forum that we have for actually delivering what we have learned so far. It's a great opportunity. Thank you, everyone.
Thank you, Ali. And I don't know, I think Dr. Abdul Malik, I think he is not here right now yet. So, Danish, I think we have 15 minutes more, or we don't?
So
I think
up trying to get Dr. Malik in so we can see if his audio works this time. He's just joining now. Dr. Malik, please try unmuting yourself and see if we can hear you.
Danish, you can at the end, if you can add to the nuts and bolts of this online course, and how the assessment will work, and of course, how to keep people engaged. Yeah, I think it's WhatsApp group or something.
Yeah. Dr. Malik, try unmuting yourself. See if you can unmute. I'll be happy to make comments, and I think we can go if participants have time. We can allow them and go another 10 minutes and have them quickly say their name and where they are practicing. At least if you want, I can try to give them the microphone. You have a list that you can go through and or share the list with me.
Fareed, if
and I thought we could also do a Q&A with them if they have any particular
or
questions.
yeah, and
there's a
maybe they
Q&A
can.
actually. There are some questions that are kind of like, there is a question that, for example, by Ali Mehdi, that please arrange online courses on research writing because so many medical students face writing researchers. So inshallah, our last course, our module will be covering that research writing. And go ahead.
Yeah, I would add, Fareed, that I think we discussed that maybe from this, because they will have to have a research project for 3 months to make it a 1-year course. So I think it's either we can move that module forward, or each faculty, or in the beginning, we may assign them some
Shahid,
topics.
the question may be from someone who is not a stroke participant. There is many attendees here, I think, who are not a stroke participant. And they're actually asking, is the registration for this course still open? And is there a way to sign up for the stroke course? And any comments on that? How to sign up or enroll for this course?
So basically we wanted to, obviously we want more and more people to learn about stroke, and I assure you that this effort will continue until we have all the interested neurologists and stroke specialists from Pakistan to learn about this. So basically, the reason we want to limit the number is to really engage with the attendees. The faculty, it's harder for faculty to engage if the classroom size, for example, if you want to use that analogy, is bigger. A smaller classroom size, then faculty can have more one-on-one, because we do not want any one of the attendee to be in the back benches and go through the course without getting full attention of each and every faculty. So that's the idea, to limit. We are not rejecting any candidate who applied or who will apply, but we would respectfully ask them to wait for the next course. Maybe we'll see if somebody drops, we can have a wait list of the candidates and see if we can add a few more. I think offline we can discuss that as well. But for now, Danish, I just wanted to add, although the question might have been for a overall research thing, which APPNA MERIT, of course, is very interested and have formed a separate committee for the research overall. But I was talking about this particular 1-year course that mini fellowship that we have. 9 months is our curriculum-based didactics, but 3 months are assigned for them. And that was the idea and requirement from Dr. Waseem Ali, that if we can give them a research project that they can do, some small or big, that they can do in 3 months, then it will complete some sort of a really meaningful 1-year kind of diploma or certification. And to that end, I would say that instead of saying that they will do the research at the end of 3 months, maybe we would look into involving them and assigning them a small research project from the beginning, so that they keep on working on that along the course and complete it in 1 year. 3 months may be a shorter time to complete it. And so this is an idea that we can further brainstorm. And that's an example when I said that we will learn as we go what can be changed, what can be added to the course.
So yes, that's we have been debating back and forth about that, and I think we will. That's something I would like to do it this way, is that have a training in the research done sooner. But then I was thinking is that it may be too dry and not very clinical to start with, because the first one is also not a clinical topic. It's more about understanding the studies. But if the participants think that they would rather have their training done sooner, then we can flip with some other module or swap the modules and do the research training sooner. So as you were saying, this is something that attendees can give us a feedback and say that how do they want, what do they want to be changed and what do they want to be modified. I think as Dr. Shahid Rafiq was asking, if Danish, if you can give a little bit of background of how the things will work in the overall, and you have done this kind of courses before, so you have a very good.
Yeah, so I will try to also cover some of the questions that are coming up in terms of timelines of the course, when this starts, and the audience. So this course is a 1-year course, which will have 9 months for didactics. Those 9 months are divided into module. We have 12 modules that will be covered. So that means that there will be a few breaks in between, but roughly about 2.5 weeks for each module to complete. Now, module, what do we mean by that? There will be some lectures to watch that will be recorded online for them to review, for you guys to review at your own time, at your own pace, and you can see them again or repeat parts of them. And then you will have some activities to do to strengthen your learning and for us to say that you are achieving some of that learning. And they will vary from module to module, but they will include things like multiple choice questions, reviewing journal article, taking an assignment to complete, so reviewing something and making a summary of it, and things like that. So we would want it to be active learning. We want it to, for you to be able to tell yourself and tell us that you are getting it, you're understanding it, you're incorporating it. The point of these assignments, we call them formative activities or formational activities. The job is more of a learning rather than assessment, and the grading or assessment is done mainly in the sense to see that you are actively participating. This is kind of a volunteer thing, right? It's not that you're already a neurologist, but you are voluntarily interested in becoming much better in providing care in stroke. And we appreciate that, but we want to be able to tell that you were involved and you were engaged and you were making an effort to understand this, and was just not along for the ride. So there will be some form of activities. We will also form a platform for discussion, so we can make a community of learning where you can discuss your own situation, your own cases, your questions, your queries in one place, along with the faculty present, and where you not only teach, you learn from the faculty, you also learn from each other. So you can, if one of you have found something that was very useful to you, an article or a table or a diagram, you can then share it with your other cohort, with your peers in that discussion, so that a common learning is happening, and we are each learning from each other. And then we sometimes employ the techniques of what we call peer grading and group assignments, where we will even have you form a small group of cohort and discuss with each other on Zoom, on WhatsApp, or online to try to come up with a final single product, so we can see that you're integrating your activities together. And also where you are giving a feedback to your own peer, your own course participant, to try to learn from giving feedback and being a teacher and an instructor yourself, and also giving kind of a different perspective to someone in your group. So that's kind of the overall view. All of this will be contained in an online platform and a kind of a website we call a learning management system. So this APPNAacademy.com will be the place where we will have all of this available to you, the recorded lectures, the MCQs, the assignments, and where you can upload and submit your work for us to look at and grade. And then we'll have a good, robust platform for discussion that we will finalize over the next few days. I believe the course starts on October 1st. And, the goal is to then consider a batch a year from now, but Dr. Suri would know the exact timelines. Dr. Suri?
So the timeline, can you see my screen?
Yeah, we can.
Yes, okay. So the first module is starting on, I went week by week, so Monday, so October 5th. But in the next few days, in the coming week, we will be setting up and discussing. I will be sharing a brief presentation about introduction. And then I will also be sharing the main course document, which is this document that I just showed it to you. We'll finalize it and share it with you. And then we will also be making sure that everyone is hooked up and connected to the online resource platform. And so after everything is set up, then October 5th is when we are going to have the first module uploaded and good to go. So the first 2 weeks, the trainees will be working with myself for the first module. And as you can see the timeline, the modules will go till end of June.
Yeah, thank you, Farid. I think Saqib wanted to add something on the research part or question. Saqib, if you want to add your comment.
Yes, I just wanted to add that we're happy to help in research anyways, but for the modules as Dr. Suri has constructed, I think we can follow those. And based on the participation of our stroke attendees, we can definitely arrange articles for them. We have a lot of international students work with our group with Dr. Qureshi's supervision. So if they want to be part of any retrospective studies or do a study back in Pakistan, you know, like we're happy to help them. And if needed, we can later on construct a module based on how to do the analysis and all that. And I'll be happy to help with that. So based on, you know, what participants need, we are happy to help in those things.
So Farid, there's a question that popped up and I want to be sure that we're all on the same page. The question is that what time the live lectures will be held on the mentioned dates. I think I want to again repeat, all the lectures will be recorded. So you will watch a recorded lecture and there will be no live lecture, and you will have from October 5th all the way till October 26th to watch the lectures and complete assignments of that module. So it may be 2 lectures, it may be 3 lectures, or an hour or so each. And you can watch them at any time. You can stop them in the middle and come back and finish it later. You can watch it again second time if you need to. They will all be available throughout the course. Once it opens up on October 5th, the module will remain open for the rest of the whole 9 months. But you're expected to complete your assignments by the next module. So if the next module starts on October 26th, you must submit all your assignments of the first module before October 26th, anytime before 26th. But usually people do it on the last day, but anytime before 26th will be fine.
I think that is Danish. Farid, sorry, the Danish, I think that is that is different.
I think
from,
Dr. Malik's microphone is working now. Or...
Okay, so let's hear from Dr. Malik.
जी मालिक प्लीज गो अहेड।
जी अस्सलाम वालेकुम। अच्छा, गुज़श्ता 1.5 घंटे से अनम्यूट हूँ, बहुत मुश्किल हो जाता है बंदे को ना बात करना, और इतनी इंग्लिश सुनने के बाद तो आदमी को वैसे भी बदहज़मी हो जाती है। तो मैं अपना तारुफ भी उर्दू में करा देता हूँ और अपनी बात भी उर्दू में कर लेता हूँ, ताकि कम से कम आपको एट द एंड ऑफ द डे उर्दू का थोड़ा सा तड़का तो लग जाए ना। तो मेरा नाम जी अब्दुल मालिक है, मेरा नाम अब्दुल मालिक है और मैं बहैसियत एसोसिएट प्रोफेसर न्यूरोलॉजी यहाँ कराची में काम कर रहा हूँ। मैं इतने सारे बड़े लोगों में सबसे छोटा आदमी हूँ और इल्मी लिहाज से भी और फहम के लिहाज से भी, तो उसमें मैं तो खुद इसमें तिफले मकतब ही समझें आप मुझे ना। तो ये जितना कुछ है उसमें डॉक्टर अदनान, डॉक्टर अशफाक शोएब और जिनसे हमने सीखा है, पढ़ा है, तो उन जैसे लोगों के साथ बैठ के सुनना समझना एक बहुत ऑनर की बात है। It's really privilege for me to have a part of this group and to have proper learning. We in Pakistan, given circumstances, we did a lot of things in stroke advocacy, stroke awareness, and also stroke teaching among the neurology as well as the family physician level. We did on almost all part of the country different workshop for the family physician as well as the neurologist. And I was also part of the neurologic stroke care in a tertiary care institute, and still a learner neurologist.
Thank you, Dr. Abdul Malik. Very nice. बहुत अच्छा लगा आपको सुन के और आप मेरी उर्दू इतनी अच्छी नहीं है जितनी आपकी माशाल्लाह से है तो थैंक यू वेरी मच
तो
आपका बहुत शुक्रिया
Yeah, I wanted to add, Fareed, that I think what the last question was about the live lecture. I think that's the different model. If Danish can correct me, if my understanding is that in family practice course there will be some live lectures.
All of them will be live.
Maybe and maybe open to all public in addition to the attendees. So that's a different model. And maybe, like I said, we'll be learning, and maybe next time we can have a live lecture week in stroke as well, so that it can be open to public and non-attendees, non-registered attendees, and so that they can learn also. But at this point, this is a closed course, and unfortunately, we had to limit the number of attendees, and like I said, but that does not mean that other people are rejected. They will be included in the next time.
So I'll just give you an idea. I mean, for example, for the first module, there are 4 presentations. There may be different timings, maybe 30 minutes, 40 minutes, and there are some documents, and this is kind of like the folder that we will share with you. And then you will have the opportunity, as Danish was saying, to review it in your own time. For example, the first module is going from October 5th to 26th. As he mentioned, you will go over these modules or these presentations on your own time and do the task.
So I think one question is कि अगर हमने online learning management system use करना है, so people ask कि अगर हम उसको भी दिखा दें. So if it's okay with you, I can take a couple of minutes and show my screen.
That's a great idea.
Okay, so this is the APPNAacademy.com. This is the online learning management system we'll be using. So you right now we're not allowing any registration. So you will have to be invited or added to the course, and then you will get an email to sign up or join the course on it. So right now it's a closed place. And then once you sign into APPNA Academy, you will see the courses that you are enrolled in. So I can see all of them, but you'll probably only be able to see the ones you are enrolled in. I'll just use my course here as an example. I'm not sure how much stroke course is done. Maybe just look at it now. So this is the mini fellowship in stroke and vascular neurology. And if I view it as a participant, preview as an enrolled student. So you can see that it will start with kind of an introduction. On the left side, you can see where your progress is at. You're in module 1. What's the topic of module? These are the objectives. These are the lecture recording. There's a required reading that you're supposed to do, optional reading, and then assignment that you're supposed to complete. And then the next one will be locked until that date, which is October 26th. So would not open up. But once you have done all of these requirements and October 26th is due, then the second module will open up, which will have similar structure. So if you're in introduction, you will mark it complete and continue. You will see the objectives, and then the lecture 1 will start. And this is a video recording which is there. I'm not sure if you'll be able to hear me.
The current presentation is to help us understand the published stroke research cocaine in elderly patients, and then it will be artificially showing that cocaine to the patient. Obviously, you only offer to the patient.
So you can watch the lectures like that, and you'll go by one, and then you can also jump to another lecture if you want on the side.
In this presentation, we are going to talk.
And then you will go to the required reading, which is this journal article that have been assigned to you. You're supposed to complete. There's optional reading, and which you can even, some of them view right there, and you can download by clicking on the download button and get a copy for your reading. And then assignment, will be what you're supposed to do, make a table of listing pros and cons. Assignment will change each module, and some module may have more than one assignment depending on the need. And you can upload or submit your assignment right there. So if you're doing a Word document, if you're doing a video, if you're doing a picture, if you're writing something or recording a lecture or whatever you're doing, you can upload it directly here as a participant. You can also, if you have uploaded it to your Google Drive or Dropbox, then you can also share it directly through your Google Drive without having to upload it again. And you can even submit a link to where your file can be downloaded from. And this will be your assignment submitted into the system, which faculty will then see that these are the submission from these 20 participants on this assignment, and they can grade them one by one. So faculty view will be different. So they will have access to the grading side, and they will be able to score it, grade it, mark it complete. And then we as an administrator, me, Dr. Fareed, Dr. Shahid, can pull up a chart and see who has completed their assignments, who are on time, who were late, how late were they, what their grades are, and how are they progressing. So all of that is available to us, but as a participant, this is kind of how you will browse it and view it. So if you have any question, you can type here. So there's a question, is it only for practitioners of Pakistan or all will get a chance? So I'm guessing there are people from other countries in the region like India, Bangladesh, and others who are probably asking this question. My view is that over time, things gradually grow. So when I started my mini fellowship in movement disorder 4 years ago, for the first 2 years, it was only for participants in Pakistan. And then for the third year, we took some participants who were Pakistani origin, but in other countries. And then in fourth batch now, we have people from all the countries. So I have 2 from India, 1 from Bangladesh, we have 1 from Kuwait, 1 from Dubai, 1 from Australia, and 4 from US and things like that. I could imagine this could eventually grow into something like that. But the first batch, I know because it's a pilot project, it's a learning thing, it's through collaboration, is for now limited to Pakistani physicians in Pakistan only, not even practicing somewhere else, is my understanding, but Shahid and Fareed can add to it. Thank you.
Yes, I think we have one candidate not from Pakistan, but yes, everyone else is from Pakistan. And the candidate is from Pakistani descent also. So you're right. Right now we are taking only, I mean, we have basically closed the enrollment right now. So yes. Dr. Shahid, is there anything else we need to cover?
And just to add to that, that enrollment will restart for the next batch after July 31st. Once we complete this batch, then we'll be restarting the enrollment and we'll be updating based on what we learned from this experience and in terms of participant selections, choices, number of participants, and things like that. So stay tuned.
I think we have covered everything. And so
Ismail Bhai joined. I think he had a comment to make. Ismail.
Assalamu alaikum. Jazakallah khairan. We were discussing about research. I have a comment to make about the thrombolysis. As we have all known through the Pakistan Stroke Society website, WhatsApp group, that TPA is going to be available very soon, inshallah, in Pakistan, and it's going to be administered at multiple hospitals. So I think one of the things that if Pakistan Stroke Society agrees, their higher ups and the chiefs agree on that, then this group can work as a sort of registry launcher for the thrombolysis in Pakistan. So the young people who are going to be part of this course, they can lead this registry and make sure that the thrombolysis is somehow observed and registered throughout the Pakistan with the help of Boehringer Ingelheim, so that this will be kind of a quality assurance as well as research.
Yes, inshallah ta'ala, we'll try to encourage and stimulate research thoughts in our approach in our candidates, so they feel comfortable and they feel energetic and motivated, dedicated towards gathering data and analyzing it and seeing they're not fearful of that there is this is something they cannot do it. So, and that's I think a very, very important topic once it is launched, to look into that, and maybe that may be the first thing they can look into. So I think overall in the next week or so, I will in a day or two, I will share this document with all the candidates and with all the attendees, and we'll post a video with a brief introduction, as we probably already or maybe share a part of this introduction as a video that Danish already presented. And then I will encourage you to set up your system and ask questions in the next coming week, so we are good to go the next week after next. Other than that, I think we have covered almost everything. I would especially like to thank Dr. Shoaib, Dr. Waseem Ali, and Dr. Adnan Qureshi for staying for this session, and would see if they have anything else to add after that before we close this session. So I think, Danish, if I don't see that, we can go ahead and close the session. We are well over time, and we can go ahead and
thank you, everyone. We will be posting the recording online for you to watch later or share with anyone who may have missed it. Thank you. Allah Hafiz.
Thank you. Okay.